The previous video discussed adult spine deformity. For this segment, we will discuss how to treat this difficult spine problem. To make the discussion easier, we will consider two separate issues. First, scoliosis, or the sideways bend of the spine. The treatment must take into consideration other possible causes of pain, such as pinched nerves. While the goal of the surgery is to straighten the spine, it is also important to take pressure off the nerves and to treat the other causes of pain. In order to correct the scoliosis and maintain this correction, fusion surgery is performed. A combination of techniques described in the previous videos will be used to aid in the fusion surgery. The images here show a patient with a scoliosis of the lumbar spine. This patient underwent an ALIF and posterior spinal fusion to achieve significant correction of her scoliosis. You can also see the surgery improve the curvature of her lower back. In cases where the patient has either had previous surgery or they have straightening of the spine, surgery to improve their standing posture may be considered. This is called sagittal plane imbalance. In the case of a patient with a previous fusion surgery, wedge cuts in the bone may need to be performed to achieve the appropriate correction. There are several different wedge cuts that may be made, and the appropriate surgery will be determined by your surgeon. When able, surgeons may choose to use interbody cages and smaller wedge cuts to achieve correction of the spine. This patient had a history of previous surgery without fusion and with an infection. Eventually, he was unable to achieve appropriate spine posture and had significant pain related to this. Surgery was performed with both A-lift cages from the front and a T-lift cage from the back, and screws replaced to improve the posture and realign the spine. These images are from a patient who was previously fused in the thoracic and lumbar spine. He is unable to stand upright due to the position of the fusion, and for this reason, 2 wedge cuts were planned. These can be seen at L2 and L4. The images following surgery show the improvement in his posture, achieving significant pain reduction and the ability to stand upright. Whatever the malalignment of the spine, appropriate initial evaluation, operative planning, and surgery can be considered to treat your adult spinal deformity.